Okay. So today's letter is this, and just by assessing the writing task or the plan, we will just make sure that what type of letter it is. It's a referral letter to a gastroenterologist. Okay. So इस लेटर में हम लोग जो भी इंफॉर्मेशन गैदर करेंगे, the information we are going to include in this letter will be related to this doctor. We will not include unnecessary information. ठीक है, जैसे कि ग्रुप में जिसने लेटर पोस्ट किया था उन्होंने बहुत ज्यादा अननेसेसरी इन्फॉर्मेशन वगैरह हर चीज ऐड की हुई थी. आज मैंने लेटर्स देखे 2, तो उसमें बहुत ज्यादा अननेसेसरी इन्फॉर्मेशन थी. अब ये है हमारा लेटर. ओके, सो ये एक रेफरल लेटर है. सो दिस इज द फॉर्मेट कि आप इस तरह से ये यू विल जस्ट राइट इट लाइक दिस. देयर इज नो नीड टू comma, no need of comma after anything. This address, you will just write it like that. Now, one more thing is that here the date is here. You can just write it like this, or you can just write 21st February 2015 also you can write. Okay, idhar mein you can write both. Usme koi masla nahi hai, but in between the letter you have to write the date in this format. Okay, so avoid this. The lady who shared the letter in the group, she just wrote the full date in between the letters, so to avoid that. Now again, when I say introduction, the purpose is very important. Okay, I always tell my students that when you are writing the purpose, make it clear and precise. Do not include unnecessary information in the introduction, and the introduction should be in such a way that if I just read the introduction, I should know that what what will happen next in the letter. Even if I don't read the whole letter, I should understand that what is the context of the letter. So the introduction should be very clear and precise. Okay, if again in the introduction you will write who are you referring to, who are you discharging, or whatever. Disease, you will mention the condition, the suffering, whatever the patient is having. Then why are you discharging, ya phir why are you referring. Okay, and if there is any special request, like if you want the doctor whom you are going to refer to carry out some kind of investigation or something, then you will mention that also in the introduction. Okay, so the introduction should be very precise and clear. It should not be confusing, or it shouldn't be like I don't know what you're going to just write. Okay, fine, this that. If you are not going to, if you do not understand that what I'm going to write, या जो भी है उस टाइम पे नहीं दिमाग चल रहा आपका, so you can just simply write, okay fine, I'm referring this patient. Now he needs your expert opinion, या फिर I'm expertise for further evaluation and management, या फिर I'm just referring this patient to your care for further assessment and management. But this kind of introduction is usually the scripted one, but it's correct. You have to write the information. Now if I will just take this introduction, now why I'm planning advice on smoking risk. Okay, counsel on IBD and likely. Okay, refer to gastroenterologist for diagnosis and assessment. Now I'm going to refer this patient to a gastroenterologist for diagnosis and assessment. So I will just mention this one thing in my purpose, in my introduction. Again, assessment kya hai? I'm just suspecting that he might be having IBD. It can be either Crohn's or ulcerative, and no urgent systemic signs. Okay, fine. So this is what I'm suspecting, and I'm now referring this patient to a gastroenterologist for diagnosis and assessment. Now, as I just told you, the simple introduction, that is the scripted introduction, can be, okay, fine, I'm writing to refer this patient. Yeah, thank you for seeing Mr. What's the name of this patient? Sorry, it's Newton, Patrick Newton. Okay, who's presenting complaints. Your sign and symptoms are suggestive of what? Inflammatory bowel disease. He needs your expert opinion. Yeah, he needs your further, he is now being referred to you. Yeah, he needs your expertise. Yeah, for further evaluation and management. But you can also write this. Thank you for seeing Mr. Newton, a 25-year-old accountant, okay, whose clinical features are suggestive of inflammatory bowel disease, either Crohn disease or ulcerative colitis. Your further assessment and diagnosis would be highly appreciated. Now you just see the difference between the two introduction. The first introduction, which I just told you, is the scripted one, which everyone writes in their what, in their introduction. Okay, your expertise is needed, your further evaluation and this. So you can just write this letter, or in more easy words, you can also write this letter. Okay, I'm writing to refer Mr. Newton, a 25-year-old male who presents with lower GI symptoms for further assessment. Okay, or you can also write it, thank you for seeing Mr. Newton, a 25-year-old male who has presented with findings suggestive of gastroenterological pathology. Your further assessment and confirmation of diagnosis would be highly appreciated. But in my opinion, if I'm, these are the different ways you can write the introduction. Now, can you see how clear my introduction was? Okay, now the introduction I'm going to write is, thank you. Sorry, I'm very bad with this, laptop and all. मुझे इतना नहीं है क्योंकि मैं मोबाइल से ही वो करती हूँ. ओके, तो इसके से थोड़ी स्पीड से देख लेना बस, ठीक है. थैंक यू फॉर सीइंग. Now there is no need to put a dot in between after the Mr. Okay, if you're going to put the dot here, so you have to put the dot everywhere. Okay, if you're skipping the dot, then skip in the whole letter. Okay, a 25-year-old accountant whose clinical features are suggestive of inflammatory bowel disease. Okay, here many people, what I see is they write IBD. Do not write, short forms. And there is also no need to write in capital. Okay, so avoid this mistake. Whenever you know the full form of any abbreviation, just write the full form. Avoid writing this. Inflammatory bowel disease, either. Now this is a disease, so I will just, again, the disease that that starts with someone's name, I would just mention in this in the group also. You don't have to write all the disease in capital with the capital letter. Like you will not write diabetes or hypertension in capital letter. But if the disease has been named after some person or the scientist who has discovered, then you will write that particular disease in a capital letter. Ulcerated disease or ulcerative. This sometimes, you can just get an idea from your case notes as well. It's they have written Crohn's in capital and ulcerative in small, so you can just copy from that. Colitis. Okay. Your further assessment, because see, I'm just diagnosis and assessment. Okay. Your further assessment and diagnosis would be highly appreciated. Now full stop. Now now just by reading this purpose, now you can see that it's clear, it's precise, and it's to the point. Nothing irregular, nothing unnecessary or irrelevant has been mentioned in this introduction. Now, even after this, just reading this introduction, if I don't read the whole letter, I will be able to understand, okay, fine, what's the patient, what's the doctor who has referred this patient to me is expecting from me. See, it's clear. And now we will just filter out the relevant information. अब इसकी क्या है, okay, fine. इसमें अगर देखा जाए तो the lady who shared the letter in the group, she did the what mistake she made was, this is the date on which you are seeing the patient. What she did was, she wrote today's date over here, and then she just started this letter. Okay, initially on 21st February the patient presented with this complaints. So मतलब कि 21st September का मैंने ये लेटर लिखा हुआ है, ठीक है, तो उसने वो सारा लेटर उस टाइप पे लिखा, जबकि वो आज एक ही दफा प्रेजेंट हुआ है, ये वन विजिट लेटर है, एंड मोस्ट ऑफ द टाइम इन एग्जाम्स यू नो दे आर वन विजिट लेटर्स ओनली, ठीक है, इजी करने के लिए बहुत मोस्ट ऑफ द टाइम्स जो है नहीं होता है। अब अगर हम इसमें से रेलिवेंट इंफॉर्मेशन को फिल्टर आउट करें, okay, 4-month history of chronic diarrhea, ठीक है, intermediate pain, okay, fine, this is relevant, lethargy, appetite, okay, fine, this presenting complaint is, or everything is relevant, okay, social history, okay, smoking, we can just mention that, squash player is unnecessary, uncle has Crohn disease, okay, this is also relevant, okay, anxiety and embarrassment relating to symptoms and social participation, okay, we can just include that, we will just read further. And dietary modification unsuccessful, okay, fine, recently stopped attending Friday, this is not relevant, has not sought medical advice, okay, diet and OTC, okay, past 6-month history, low grade pain, right, and this is, you can mention this because that's the past medical history, and you know we also have it can be relevant because in many times when he's having all this condition, we can mention that, okay, fine, medications also we can mention, and what else he has, objectives may, okay, this is relevant, no hepatosplenomegaly, okay, fine. Ab dekho, now just you can see hepatosplenomegaly, the spelling is not written, so you have to write a proper spelling. In writing, your spelling matters a lot, okay, and make sure that your spelling is correct. Cardiovascular, okay, fine, okay, urine, this, okay, fine, we will just mention this, okay, positive fecal blood, okay, we will mention this, mildly elevated, this, inflammatory, okay, fine. Now we are writing to a gastroenterologist, so, and this is a normal referral letter, so mostly after normal referral letter, after introduction, you will write a paragraph of personal history. Again, if personal history is not relevant, like, you know, he's a squash player, he's this, he's that, so that's something very irrelevant, so you can skip this part, you can skip writing the personal history and you can just move forward. But when there is you know, one visit letter, so then most of the time some of the personal history is relevant because you have, you know, आपको 150 180 words आपको cover up करने होते हैं, so इतना कुछ data होगा कि आप उसमें लिखोगे. So next my paragraph will be of patient's personal history, ठीक है. अब अगर personal history का paragraph है, now again पर्सनल हिस्ट्री मैंने बहुत ज्यादा देखी है, लोग इसमें किस तरह से लिखेंगे मोस्टली, मिस्टर न्यूटन रेगुलरली प्लेज स्क्वाश एंड डज नॉट हैव एनी नोन एलर्जीज, ओके, he had low grade intermediate pain in both wrists, ठीक है, 6 months previously, okay, his uncle was also diagnosed with Crohn disease, ठीक है, most of you will write the personal history in this way. अब अगर देखा जाए तो मैं गैस्ट्रोएंटरोलॉजिस्ट हूँ, यू नो स्टमक की डॉक्टर हूँ, मुझे क्या लेना देना उसकी जो है क्या कहते हैं स्क्वाश खेलता है कि नहीं है, इट्स इररिलेवेंट, ठीक है. सो द प्रॉपर हिस्ट्री, you this paragraph you can just write it in a proper way, you can write, okay, fine, again smoking is important, you can mention that smoking, ठीक है. You will mention this smoking because many times, you know, smoking do affects our gut, and many medications, you know, if the person is a smoker, something, and again, you don't have to be judgmental, you will not say, okay, fine, he is a chronic smoker or this, that, you have to avoid judgmental terms. So what you will write is, Mr. Newton smokes 10 to 15 cigarettes per day, or you can write daily. ठीक है, just to show your vocabulary, you can write daily instead of per day. Otherwise you can also copy that, there is no issues that daily. Okay, in terms of his medical history, या फिर इसमें जो है, if you can just, if you want, you can avoid this and this also. In terms of medical history, you can avoid this also. In terms of medical history, comma, he has intermittent pain in his both wrist joints, for which he takes ibuprofen. Okay, now regarding the medication, if it's the generic name, you will write it in small letter. And if it's the market name, then you will write in capital letter. Okay, now you will just write, please note his uncle has a positive history of Crohn's disease. Now, again, my introduction is very short. Sorry, my personal history paragraph is very short and precise. I have not used complicated sentences. जैसे कि अक्सर ग्रुप में देखती हूँ, okay, regarding his, he has a positive history of Crohn disease in relation to his uncle, ये वो सब इस तरह करके लिखा होता है. या फिर okay fine, ठीक है, he has a positive history, या फिर he has pain in both his wrist joint. Up, you can also mention wrist joint. He has intermittent pain in both his wrist joint. ठीक है, for 6 months. You can mention the duration also if you want. Okay, wrist joint 6 months previously. ठीक है, क्योंकि इसमें क्या लिखा है इसके पास, just कहाँ है social family history. Okay, 6 month history है, low intermediate joint pain in both wrist. ये past medical history है. ठीक है, 6 months back था, वो अब चला गया. ठीक है, previously he had. आप लिख सकते हो, okay fine, if you want, you write, you can write, okay fine, he had intermittent pain in both wrists 6 months previously. ठीक है, for which he was taking ibuprofen. ठीक है, या फिर यू कैन जस्ट राइट, ओके फाइन, 6 month हिस्ट्री. अगर आप देखा जाए तो इसमें से क्या है, 6 month हिस्ट्री है. स्टिल दिस समथिंग, मैंने बहुत सारे लोग क्लियर नहीं है. ओके फाइन, ठीक है, 6 month हिस्ट्री इसकी अभी भी चल रही है. ओके, तो आप सिंपल से जो आपको इसमें से समझ में आ रहा है कि ओके फाइन, ठीक है, इसके मास में निकल गया है कि 6 month की इसकी हिस्ट्री है. किसके लिए? लो ग्रेड, यू कैन ऑल्सो मेंशन दिस. ओके, लो ग्रेड इंटरमीडिएट पेन इन बोथ हिज wrists. ठीक है, for which he takes ibuprofen. सिंपल कर दो, क्योंकि अगेन रिस्ट में क्या चल रहा है वो गैस्ट्रोएंटरोलॉजिस्ट को कोई फर्क नहीं पड़ता, बट ही इज टेकिंग एनी काइंड ऑफ अ मेडिकेशन, सो यू विल जस्ट मेंशन दैट. ओके फाइन, ओके फाइन, जो है इसकी कोई हिस्ट्री है फॉर विच ही इज टेकिंग मेडिकेशन. अब हम लोग आ जाते हैं उसके द नेक्स्ट पार्ट. अब जो हमारी बॉडी ऑफ लेटर है, दैट इज नोन द कंटेंट. अगेन, कंटेंट में क्लैरिटी होनी चाहिए और कंसाइज होना चाहिए. Content जो है, that's the information that you include in your letter, and conciseness and clarity is the information that you have omitted from your letter. That how clear and concise and your letter is. If you will just add unnecessary, irrelevant information, then it will create some kind of a confusion. Okay, and many people just do add unnecessary, irrelevant information in the the body paragraph or something, which just creates के confusion create करता है. क्योंकि fine, ठीक है, ये है क्या, लिखा क्यों है, मुझे क्या करना है इससे. So you have to avoid that thing. So you have to क्या है, just filter the case note. So it's very important in the first 5 minutes, just read the case note. Make a template in your mind. Okay, और जो ग्रुप में जिसने लेटर शेयर किया था, it was about 3 to 4 paragraphs. Avoid writing this long set, क्या कहते हैं, a letter. अगर तो for example, if multiple visits है, you will try to combine that multiple visits in one paragraph if it's of the same complaint. If the complaint is changing, okay, fine, then you can make a new paragraph. But if the complaint is the same, okay, you can just write the main complaint again, relevant to the doctor. You will just mention it in one paragraph, and then today what happened and what is his progress, you will just mention it another paragraph and just conclude the letter. So now, if I will just see this, okay, and one line space is needed after this re also, and then one line space you have to write that the letter which was shared in the group, there was no space. Now again, this patient came today, and this is a one letter visit, and he's presenting to you for the first time. Okay, so now what you will say, okay, fine, what was his complaint? This is his complaint, which is all relevant. So you can write it in a way. Today there is no need to write, okay, fine, as it was shared in the group initially on 21st February. No, he just came today. This is same letter. In exam also, they will tell you that assume today's date is this. So you will assume that, and if there is no date written anywhere, so you will assume that, and you will just write with that date. And if you will assume that date, you will write that date. This where I have written this one, you will just mention that date over here, and then you will just read your case notes. Either it's in past or it's happening today. If there is no date over here, then you will assume, okay, fine, the patient is coming here for the first time to me. Okay. If this 21st February 2015 has been mentioned, and they are also said, okay, fine, today, assume today's date is this, then you will say, okay, fine. Initially, yeah, on 21st Feb 2015, he presented me, and always write the letter in the passive, in passive tone. Okay, so what you will write here is, okay, today again, Mr. Newton presented with the complaint of what? Chronic mild diarrhea. Okay, and what? Right lower abdominal pain for 4 months, and right lower abdominal pain for 4 months. Okay, then full stop. In addition, he reported what? Lethargy, decreased appetite, and weight loss. Okay, in addition. And yes, someone in the group also was asking that, okay, fine, we have to write in capital or something. No, you will just write in small letters. He reported lethargy, decreased appetite, decreased appetite, और क्या है इसका, and weight loss. Okay, now you have seen that, okay, fine, I have written this sentence in, I have written the presenting complaints in very simple sentences. Okay, मैंने कोई complex sentences use नहीं किए, कोई मैंने twisting नहीं की. जैसे कि आज ग्रुप में भी मैं अगर ग्रुप खोलूं अभी, ओके फाइन, ग्रुप में जिसने भी लेटर शेयर किया, आपने देखा होगा किस तरह का वो लेटर था. तो उसमें इतना, the poster who just wrote the letter, just writing this presenting complaint, she just added a connector also, like 1 or 2 connectors also she added in that. avoid using many connectors. Connectors shows that okay fine, OET को नहीं पसंद के जो है ऑफिशियल्स को कि आप कनेक्टर ज्यादा यूज करें. इट मींस कि आपकी इतनी वोकैब नहीं है, या फिर आपको इतने सेंटेंस कंस्ट्रक्ट करना नहीं आते, इसलिए आप इतने सारे कनेक्टर्स यूज कर रहे हैं. ठीक है, तो अवॉइड करो इतने ज्यादा कनेक्टर्स को यूज करना. अब मेरा ये आ गया, मैंने सिंपल सी इंग्लिश में ओके टुडे मिस्टर न्यूटन प्रेजेंटेड विद कंप्लेंट्स ऑफ chronic mild diarrhea and right abdominal pain for 4 months, क्योंकि दिस वाज बोथ एक साथ था, तो मैंने इसको एक साथ लिख दिया. ओके, इन एडिशन मैंने यहाँ पे ओके फाइन किया, ही रिपोर्टेड व्हाट लिथार्जी, डिक्रीज्ड एपेटाइट एंड वेट लॉस. ओके फाइन, ठीक है, मैंने वेट लॉस मेंशन कर दिया. जरूरी नहीं है कि मैं उसका ये भी लिखूं कि ठीक है उसको 4 kg वेट लॉस हुआ था या वो, आप चाहो तो उसको मेंशन कर सकते हो, बट अगेन इतना जरूरी नहीं है, लेकिन आप चाहो तो उसको मेंशन कर सकते हो वेट लॉस को. ठीक है, तो आपने वहां पे उसको वेट लॉस को मेंशन किया अपना. और उसके बाद अब दूसरा क्या आ गया, अब आपने देखा, अब दूसरा क्या था इसमें, हमारे जो वो था कि उसमें क्या था इसका, आई जस्ट रेड इट समवेयर कि ओके फाइन, एक मिनट, नाउ अगेन दिस ओके फाइन, दिस वन इज थिंग, ये हम लोगों ने लिख दिया यहाँ पे अपनी पर्सनल हिस्ट्री के अंदर. नाउ dietary modification unsuccessful in alleviating the symptoms. Okay, now we will just mention this one thing. Okay, fine, he made some kind of dietary modification, but he was unsuccessful in, but that dietary modification was not successful in relieving his symptoms. So we will just mention this. Okay, now I will, you can write weight loss ho gaya, dietary modifications failed to improve his symptoms and condition, and his condition hampers his social participation. Okay, ये हमने लिखा. अब हम लोगों ने क्या किया, हमने ये दो सेंटेंसेस को कर दिए कि ओके फाइन, ही इज हैविंग एंजाइटी एम्बैरेसमेंट रिलेटिंग टू सिम्टम्स एंड इम्पैक्ट ऑन सोशल पार्टिसिपेशन, एक ये हो गया. और डाइटरी मॉडिफिकेशन जो है इसकी अनसक्सेसफुल थी. ओके, सो यू कैन मेंशन दिस. ओके फाइन, इन एडिशन ही रिपोर्टेड व्हाट लिथार्जी, डिक्रीज्ड एपेटाइट एंड वेट लॉस. ये एक चीज हम लोगों ने ये मेंशन कर दी. दूसरी चीज व्हाट वी विल मेंशन इज, we can also add a connector over here if you want, but again you can avoid the connector also, or you can just after this you can write on examination also you can write okay, you can first write okay, on examination this whatever the examination finding is there, you can just mention that, and after you can write okay fine, dietary modifications were done ya jo bhi hai is tarah karke you can mention it over there. Now what you can write over here is, however, dietary modifications fail to improve his symptoms and his condition hampers his social participation. We will just mention it, however, comma, dietary modification failed to improve his symptoms and his condition hampers his social participation. Okay, so now what happens? Okay, fine. I have told the reader that he made some kind of dietary modification, which was which failed to improve his symptoms, and this condition what he's having is hampers his social participation, that he's embarrassed. I'm not using the the same words. You can just use these kind of words to show your vocabulary instead of just copy pasting that. You will get more marks by paraphrasing or using the synonyms. Okay, so now I will just mention about on examination, comma, generalized abdominal tenderness was noted. Yeah, appreciated you can also use. Was noted without any hepatosplenomegaly was noted without any hepatosplenomegaly. Again, you see, मैंने simple sentence, simple tenses में मैंने एग्जामिनेशन में मैंने कोई इसको twisted नहीं किया कि okay fine ठीक है उसको what I have seen in most of the letters, okay fine, he was having a tenderness, he was having an abdominal pain more prominent in this lady, in this region, in that region. No, मैंने सिंपल सा एक लिखा ओके फाइन ठीक है, उसको वो चीज नहीं थी उसमें वहां पे, दैट ऑन एग्जामिनेशन जनरल abdominal tenderness was noted without any hepatosplenomegaly. Now I'm just going to write this investigation. Okay, now इसमें investigation and what I see is that okay fine, his WCC is raised and RCC and hemoglobin is reduced. Now you can either use this abbreviations, there is no issue. You can also use the full form. Okay, it's correct both the ways. If you do not know the abbreviation, then just use if you don't know the full form of the abbreviation, then just use this one. Okay, so what we will write, okay, over here I will just write it here. Okay, now again his investigation his investigations revealed high levels of what? Capital WCC, comma, ESR, okay, and CRP, and CRP. Okay, now I can again use a connector over here. Okay, now whereas contrasting one, his HP and RCC were low, along with what? I will just write positive and yes, just write the spelling what is mentioned in the case notes. Okay, fecal occurred blood test, full stop. अगेन देखा कि मैंने इसको बहुत इजी वे में इन्वेस्टिगेशंस को सब में वो कर दिया, बजाय इसके कि मैं ओके फाइन ठीक है मैं बहुत ज्यादा एंड करके एक कनेक्टर लगाया, मतलब कि सारी हाई लेवल्स मैंने एक साथ लिख दिए, लो लेवल्स एक साथ कर दिए, उसके साथ अलोंग मैंने करके उसको एक जो लास्ट वो रह गया था उसको मैंने वहां पे वो पॉजिटिव कर दिया. ठीक है, नाउ you can also after this you can use another connector if you want. As a result, consequently he was cancelled on IBD या फिर inflammatory, क्योंकि हमने यहाँ पे इसको क्या किया, काउंसिल किया. अब हमारा अगर ये देखा जाए, what we have done is we are done with presenting complaints, we are done with this, we are done with past medication, we are done with ibuprofen, everything. Now this section is done. Now we are done with what? Objective. We are done with all his investigations. Now what we have done, now what we did further is that we are just suspecting either he might be having this or this, and again there is no urgent systemic signs, and we are going to advise him on this, and we are going to do this. So now we have also, what we have done is we have counseled him about this. Now when we have mentioned everything, this is the introduction, this is this past medical history and everything we have mentioned. Now many people just get confused that what we are in the plan, that what we are going to do, we are going to write this to the referring doctor, okay fine okay, you will do this or this is or we have done. No, will just see counsel on this, Now this is the plan. Now you're going to advise him, advice on this. Okay. So where was I? Okay. Where were we? Okay. See, now I have just mentioned everything. Now we are going to write this thing, the plan. Okay. Now what I did next is, okay, fine. I have just mentioned, okay, fine. This patient is having this diarrhea, presenting complaint. He's having weight loss also, and dietary modifications failed to improve his symptoms, and his condition hampers his social participation. Okay, instead of writing two different sentences, I just wrote one sentence and I mentioned both this thing. Okay, now on examination also, okay, fine, I just wrote, okay, fine, generalized abdominal tenderness was noted without any hepatosplenomegaly, full stop. His investigations revealed high levels of, again, border, the levels which were high, I just mentioned together. Again, there is no need to write this, the labs. Okay, you can just write this also. If you want to write, you can write, but again, no need. And then, okay, fine, whereas, comma, here's this contrasting sentence, I just wrote it in one sentence. Okay. Now, what's left is that I have counseled him and I have advised him for smoking cessation. Okay, so I will just write it here. Now you can use a connector such as a result, or hence, yeah, consequently. Okay. You can use any three of this. Just a minute. Anyone, if everything is clear till now, if anyone has any questions, then they can just ask.
I have one question. What about this date? Because I am confused writing the date. Should we write the date of that is mentioned in the case note, or we should write the date of the exam?
Well, very good. You know what happens is, in the real exam, they will write, okay, fine, assume today's date is this. It will be mentioned there. Okay, and the date, in the, here they will mention in the beginning, they will mention it, okay, assume today's date is this. Okay, then you will write that date in the examination. Okay, and then you will assume, okay, fine, today's date is that, and then the task will go according to that. If there is no date written, if there is no assumptions or something, there is written, then what you will do is, you will write the date of his last visit, like that is his today's visit. For example, agar jaise ki ye wala patient hai, if this patient just came on 21st February 2015, and next he came on 25th Feb 2015, then he came on 26th Feb 26th March, okay, 2015, then you will write today's date, and that will be his last visit. Okay, then you will write, okay, fine, today's, you will just mention here that, okay, fine, 26th March 2015. Then you will write, okay, initially on 21st Feb 2015, he presented with complaints of this. On his subsequent visits, this. You will just mention it there. Is it clear now?
डॉक्टर हिना, मुझे एक चीज पूछनी है।
जी।
डॉक्टर हिना, ये पेशेंट की जो फैमिली हिस्ट्री है वो मेंशन मतलब करनी जरूरी होती है, जिस तरह उसके चिल्ड्रंस के बारे में, या वो मैरिड है या विडो है या
नहीं, अगर तो जैसे कि फॉर एग्जांपल, अगर आप एक किसी साइकोलॉजिस्ट को लिख रहे हो, ठीक है, किसी उस चीज के लिए लिख रहे हो, अगर उस बंदे को डिप्रेशन है, तो आप मेंशन करोगे, ओके फाइन, ठीक है, वो विडो है, जो है ना, वो लीव, जो है ना, अकेले रहता है, अलोन रहता है, या कुछ है, वो उस टाइम पे आप मेंशन करोगे। अदरवाइज जैसे इस कार्ड में अगर इसका लिखा होता है कि ओके फाइन, जैसे यहाँ पे शायद लिखा हुआ भी है कि, या फिर जैसे ये स्क्वॉश खेलता है, रेलेवेंट नहीं है। अगर मैं जो है, क्या कहते हैं, orthopedic होती डॉक्टर, if you're just writing to an orthopedic doctor, then you will mention, okay fine, he plays squash daily, and wrist का ये हो गया था, both था 6 months का था, and he was taking over the counter this, and he was having pain both the wrist, intermediate था, जो भी था, low grade था, high grade था, medium था, जो भी था, तो वो then you will mention it. If it's not required, then do not write it. क्योंकि मुझे क्या लेना देना कि वो कितने बच्चे हैं उसके। इसी तरह again, most of the time, वो उससे भी नहीं होता लेन देन ऑक्यूपेशन से, जैसे मैंने यहाँ पे लिखा है। ओके, यहाँ पे भी अगर आप इफ यू वांट यू कैन omit दिस ऑक्यूपेशन। Okay, date of birth, if you just writing here instead of date of birth you're writing his age, like aged 25-year-old. If you're writing it here, you can skip this from here. Thank you, then you will just write, okay, thank you for seeing Mr. Newton, who again, whose clinical features are suggestive of this. You can omit this. Again, his occupation is not relevant to what the disease is having. Okay, so you can remove that. Okay, now what I will write here is again,
Dr. Hina, I have a question. Sorry टू इंटरप्ट यू। मैं आज बिल्कुल फर्स्ट टाइम ये राइटिंग देख रही हूँ, तो मुझे सिर्फ ये पूछना है कि लाइक जैसे आपने फर्स्ट पैराग्राफ के अंदर लिखा है कि ही इज बिन विद द क्लिनिकल फीचर्स ऑफ इन्फ्लेमेटरी बावल डिजीज, सो ये हम हमेशा इसी तरह विद द डायग्नोसिस शुरू करेंगे और फिर फर्दर पैराग्राफ में हम उसकी क्रोनोलॉजी में बताएंगे कि हाउ ही प्रेजेंटेड एंड देन मतलब हिस्ट्री ऑफ प्रेजेंटिंग कंप्लेन, ये इसी तरह होगा ऑर्डर जैसे आपने लिखा है ना इन्फ्लेमेटरी बावल डिजीज, सपोज डैमेज कार्टिलेज है या जो भी डायग्नोसिस
अच्छा
है
नहीं,
वो मैं
एक
मेंशन
मिनट,
करूंगी।
मैं एक मिनट बताती हूँ। एक तो मैंने YouTube की वीडियो शेयर की है ग्रुप में जिसमें फॉर्मेट है, ठीक है,
ठीक है,
सारे
ओके,
लेटर्स का फॉर्मेट है। एक तो आप वो वीडियो देखो तो आपको एक आइडिया
ठीक
होगा
है,
फॉर्मेट क्या है, ठीक है, लेटर राइटिंग का। ये एक नॉर्मल रेफर लेटर है, एंड
ओके,
नॉर्मल रेफर लेटर सून आफ्टर इंट्रोडक्शन वी विल राइट द पर्सनल पास्ट मेडिकल हिस्ट्री या उसकी फैमिली हिस्ट्री इफ इट्स रेलेवेंट। ओके,
ओके,
if it's the urgent letter then we will skip this part, we will write,
हाँ,
you know, उसको हम chronological में नहीं स्टार्ट करेंगे, उसको हम दूसरे तरीके से स्टार्ट करेंगे। वो
हाँ,
अगेन
हाँ,
वो आप वीडियो देखोगे आपको आइडिया हो जाएगा।
ठीक
अब
है,
इसमें
आइडिया हो
मैंने
जाएगा,
क्या किया,
ओके,
मैंने ये इंट्रोडक्शन लिया, जैसे कि मैंने आपको
हाँ
कहा
आपने,
था ना कि जैसे अगर आपने अभी ज्वाइन किया या फिर इससे पहले नहीं ज्वाइन किया, तो जैसे कि मैंने शुरू में कहा था कि एक फिक्स टेम्पलेट भी है इसका लिखने का। ओके, आई एम राइटिंग टू रेफर मिस्टर न्यूटन, देखिए, whose clinical features are suggestive of inflammatory bowel disease, full stop. He now needs your expertise, ठीक है, for further assessment and diagnosis, ठीक है, आप इस तरह से भी लिखते हो या फिर आप इस तरह से your further assessment and diagnosis would be
वो
highly
ठीक है, हाँ,
appreciated, ठीक है।
हाँ, और फिर
लेकिन
आपने पर्सनल
अगर
हिस्ट्री
आप,
लिखी है,
यस, लेकिन
हाँ,
अगर आप इस तरह से लिखेंगी तो देखें कि मैंने उसको पूरा बता दिया कि मैं आपको रेफर करी हूँ क्योंकि मैं सस्पेक्ट
बिल्कुल, हाँ,
कि उसके
या
क्लिनिकल
व्हाट
फीचर्स
इज योर एम,
सजेस्टिव है, बट अगेन
ठीक है,
आई
हाँ,
एम नॉट श्योर कि क्या है।
आपका
अगर तो
एक्सपर्टीज
जैसे
चाहिए,
उसमें
हाँ,
लिखा हो, अगर यहाँ पे लिखा होता कि ओके फाइन, ठीक है, इन्फ्लेमेटरी बाउल डिजीज है और जो है ना सो क्रोहन डिजीज है, जो कि उसके फीचर्स जो है ना सजेस्ट कर रहे हैं कि उसको क्रोहन्स है, तो फिर आप
हाँ, हाँ,
यूज क्लिनिकल फीचर्स, ठीक है, सजेस्टिव इन्फ्लेमेटरी बाउल डिजीज मोस्ट लाइकली क्रोहन्स,
ठीक
ठीक
है,
है। फिर आप उसमें करेंगे योर फर्दर, फिर ये, क्योंकि मुझे इसका रेफरल में क्या आ गया, मुझे उसका डायग्नोसिस भी चाहिए और असेसमेंट भी चाहिए, और मेरे यहाँ पे डायग्नोसिस के साथ क्वेश्चन मार्क लिखा हुआ है। अगेन आई एम नॉट
जी,
श्योर
जी, हाँ, हाँ,
बिकॉज
आपने
आई एम,
सजेस्टिव लिख दिया,
ये
हाँ,
सजेस्टिव है। अगर तो
हाँ, हाँ, वो ठीक है,
क्रोहन होता उसको, ओके फाइन, ठीक है,
हाँ,
ठीक है, आर सजेस्टिव की जगह फिर हम लिख सकते हो कि फाइन, ठीक है,
he has been diagnosed with inflammatory bowel disease or something
यस,
like that.
डायग्नोस्ड भी हो
वो
सकता
मैं
हो सकता
वो
है,
मैं समझ
या
गई डॉक्टर हिना,
कंसिस्टेंट भी हो सकता है।
हाँ, हाँ, कंसिस्टेंट भी हो सकता है। मेरा सिर्फ ये क्वेश्चन था कि हम लोग HOPC हिस्ट्री ऑफ प्रेजेंटिंग कंप्लेन जैसे आते हैं ना प्रेजेंटिंग कंप्लेन के बाद, तो वो उसमें जाऊंगी या पहले पर्सनल पास्ट हिस्ट्री और फिर हिस्ट्री ऑफ प्रेजेंटिंग कंप्लेन जैसे आपने इस वाले में किया है?
ये नॉर्मल रेफरल का ये पैटर्न है। आप
ओके,
इसके
ठीक है,
बाद
ओके,
जो है, इसके बाद आप इसकी पर्सनल हिस्ट्री लिखेंगी,
जी,
ठीक
जी,
है। आप इसको इसमें इसके बाद, क्योंकि आप गैस्ट्रो को लिख रही हैं तो उसको उसके बारे में कुछ नहीं पता, तो आप इसकी पर्सनल हिस्ट्री लिखेंगी,
वो
वो
बता
भी
दी
अगर
और फिर
रेलेवेंट है। अगर फॉर
ठीक है,
एग्जांपल यही लेटर
हम्म,
अगर इसका बहुत ज्यादा विजिट्स के साथ होता, ठीक है,
हाँ,
और मुझे ये लगता कि ओके फाइन, ठीक है, मैं ये लेटर जो है ना 150 वर्ड 180 वर्ड्स में मैं इसको नहीं कंक्लूड कर सकती, फॉर एग्जांपल, ओके, अगर मल्टीपल विजिट्स है एंड यू जस्ट कांट कंक्लूड दिस लेटर इन 180 वर्ड्स, देन यू कैन skip this personal
ठीक है,
history
एंड देन
paragraph
उसमें
if
आ
it's
जाएंगे,
irrelevant, like smokes, you can skip that also, but you can just write also in terms of this wrist one, you can skip. Okay, and then his uncle, yes, this something is that okay fine, you can also skip this uncle, or you can just write it, okay, he has a positive family history of Crohn
फैमिली हिस्ट्री,
disease.
हाँ,
You can just
ठीक है,
write, you can, or you can just mention it in somewhere, in initially in somewhere, या कुछ भी अगर आपकी जैसे first visit होती है, okay fine, initially on this is in end, you can also write please note, he has a positive
Mm.
family history of Crohn disease. You can
Okay.
just mention a word there. Now I will use
Mm.
another. I will use a. Now we just write let the letter. Now what I will write is here. As a result. Okay. As a result, he was counseled on. He was counseled on what? IBD and likely investigations. So again, you either you can write IBD or you can write inflammatory. It's
Bowel
okay.
disease.
ठीक है. अगर आप inflammatory भी लिखोगे तो भी कोई मसला नहीं है. Inflammatory bowel disease with likely investigations and was advised what to quit smoking. Full stop. ठीक है. ये यहाँ पे ये हो गया. मैंने इन दोनों चीजों को अगेन एक ही सेंटेंस में मैंने लिख दिया कि ओके फाइन ठीक है. एज अ रिजल्ट ही वाज कांसल्टेड ऑन इन्फ्लेमेटरी बाउल डिजीज एंड या विथ लाइकली इन्वेस्टिगेशन. मैं अगेन यहाँ पे I will not use and over here because I will use and again using and then writing comma then using and. You can use another thing. Okay, you can also write with likely, yeah, along with likely investigations, yeah, jo bhi hai, you will write it with investigations and was advised to quit smoking. Okay, now what you can do is, now we are writing the last paragraph, that's the conclusion paragraph. ठीक है. तो अब ये till here conclusion paragraph, your body, this all thing will count. Okay, in your body, in your letter, it will count. Okay, so now what you can write is, as मैंने यहाँ पे नहीं लिखा कि refer, क्योंकि I'm referring. ठीक है, यहाँ पे refer है. ठीक है, मैंने यहाँ पे thank you से किया है, तो मैं conclusion में चाहूँ तो refer मैं कर सकती हूँ. ठीक है. Mr. Newton is referred to you for further evaluation and confirmation of his diagnosis. Again, मैं वही चीज बोल रही हूँ. Again with paraphrasing. ठीक है. या फिर मैं इसको जो है इस तरह से भी लिख सकती हूँ कि फाइन ठीक है. In view of the above, या ठीक है, given the above finding, Mr. Newton was if in view of the above, I am referring Mr. Newton. ठीक है. For what further investigations and yeah, for the evaluation and confirmation of his diagnosis. You can write it in both the ways. ठीक है. तो यहाँ पे again बहुत सारे लोग ये गलती करते हैं that they just write the same sentences, the same wording that they write in the introduction and they copy paste it over here. No, try to make your introduction and conclusion different. Do not copy that same thing. You will not get the marks. Okay, if you're just writing the same thing, even this conclusion is included in the word count, you will not get the number. If you're writing the same thing, so you have to paraphrase it, or you have to write something different. For example, if I just if in the introduction, if there was any kind of investigation or something has been they have been written in the plan, and I have not mentioned it in the introduction, then I will, okay fine, I will mention it in the conclusion. Okay, so यहाँ पे what I can write now, Mr. Newton is referred to you for further evaluation and confirmation of his diagnosis. You can write it simple like this also, or you can write, okay, given the above finding, yeah, in view of the above, your further management would be highly valued. You can write this also because you have written everything precisely and clearly over here. Okay, so I will just write the conclusion, or you can also write, okay, fine. I believe, ये वो इस तरह करके. But again, if you're writing the letter in the passive form, then I would suggest that write the introduction, so the conclusion also in the passive form. Do not write it in the, this active form. Okay, fine, take it, I'm referring you, or this something like that. You can avoid that also. Just a second, please.
So in terms of passive हम ये भी लिख सकते हैं कि in view of the above Mr. Newton will no, in view of the above your expert opinion will be will be needed in order to in order to have further management.
Sorry, आप उसमें लिख सकते हो कि I would be grateful if you kindly assess and treat his condition accordingly. You can that also. You can write that also. आपको again उसको इतना वो करने की जरूरत नहीं है. Okay, fine. You can, in view of the above, your further evaluation for possibility of either Crohn disease or ulcerative colitis will be appreciated. आप ये भी लिख सकती हो, ठीक है. लेकिन again मैंने इसको यहाँ पे इतना डिटेल में एक्सप्लेन कर दिया, तो मैं यहाँ पे अवॉइड भी कर सकती हूँ. लेकिन अगेन मैं
हाँ, बस एक
मैंने उसको,
सेंटेंस.
क्योंकि मैंने उसको पैराफ्रेज कर दिया है, ठीक है.
जी जी
या
जी.
फिर आप जो है
in
इसको
view of
ये भी
the
कर सकते
above,
हो कि फाइन,
your
इन
expert
व्यू
opinion.
in view of the above, I'm referring Mr. Newton for diagnosis and further assessment of his condition.
जी
ठीक है.
हाँ, तो ये
मैं
मतलब
क्योंकि
पैसिव
मैंने
नहीं होगा, लेकिन ये
यस
भी ठीक होगा, राइट?
यस
ये
ठीक है,
दिस इज
क्योंकि
नॉट
मैंने
पैसिव.
ऊपर
हाँ,
यस, क्योंकि ये एक रेफरल लेटर है, मैंने ऊपर में
ठीक है.
कहीं रेफर नहीं मेंशन किया, तो मैं नीचे में चाहूँ तो मेंशन कर
नीचे
सकती
लिख
हूँ.
देंगे आप. हाँ
यस
हाँ हाँ,
एग्जैक्टली. तो इसको,
या मैं
और
समझ
मेरा
रही हूँ.
आपने देखा मेरा इंट्रोडक्शन भी डिफरेंट है, कंक्लूजन भी
हाँ जी,
डिफरेंट
हाँ.
हो गया, ठीक है ना. वो मैंने सेम कॉपी पेस्ट नहीं किया, मैंने
या
फर्दर असेसमेंट नहीं किया, ये वो, ठीक है.
हम्म,
मैंने उसको डायग्नोसिस करके कुछ मैंने उसको वहां से उसको कर दिया. सो देयर मेनी वेज टू राइट. ओके, गिवन द अबव फाइंडिंग्स, इस तरह करके ये जो भी है इस तरह करके आप उसको चेंज करते हो,
ओके ओके,
ठीक है.
ठीक है ठीक है.
तो
पर
अभी
अगर ये जो फर्स्ट आपने इंट्रोडक्शन में जो लाइन लिखी है, योर फर्दर असेसमेंट एंड डायग्नोसिस वुड बी हाईली अप्रिशिएटेड, सो यू कैन ओमिट दिस लाइन एंड यू कैन ब्रिंग इट डाउन इन द कंक्लूजन. ऐसा भी कर सकते हैं ना?
यस, आप कर सकते हैं, लेकिन
हाँ,
अगेन मैंने आपको जैसे कहा कि ओके फाइन, आपका इंट्रोडक्शन इतना कंसाइज होगा ना कि आपको, मैं अगर पूरा लेटर ना
ठीक है.
भी पढूं तो मुझे पता
हाँ
चल जाए कि भाई आपने क्या लिखा है,
हाँ हाँ, ओके ओके ओके, ठीक है ठीक है ठीक है.
ठीक है ना. तो आपका
अंडरस्टूड.
इतना
जी,
अच्छा वो
गॉट इट.
लेटर होगा ना, तो वो ज्यादा आपको, क्योंकि देखिए फर्स्ट इंप्रेशन आपका अच्छा
जी
पड़
जी
गया,
जी.
कि ओके फाइन,
हम्म
ठीक है, आपने क्लैरिटी आ गई आपकी इसके अंदर,
हम्म,
तो आपका
या
फर्स्ट इंप्रेशन अच्छा हो गया. तो आपने उसके बाद आप दूसरे उस पे गए, तो
हम्म
आपका वो हो गया. तो अगर मैं इसको यहाँ से लेके जाऊं, जैसे मैंने सारे भी इंट्रोडक्शन आपको बताए, उस तरह से भी लिखते हो कि फाइन, ठीक है, इन व्यू ऑफ द अबव आई एम रेफरिंग मिस्टर न्यूटन,
हम्म
ठीक है, इनटू योर केयर फॉर फर्दर असेसमेंट एंड डायग्नोसिस ऑफ हिज कंडीशन. मैं
हम्म,
ये भी लिख
या
सकती
इट
हूँ,
विल
या
बी
फिर मैं इसको
पैराफ्रेज, इट विल बी
ठीक है,
डिफरेंट.
यस. अगर मैं इसको, चलो मैं इन व्यू ऑफ द, अगर मैं ये इसी तरह से लिखूं, अगर मैं आपको दो तरीके से लिख के दिखा देती हूँ इसमें. इन व्यू ऑफ द अबव, कॉमा, या इन लाइट, इन व्यू ऑफ द अबव I am referring Mr. Newton, या फिर I'm referring Mr. Newton into your care, या फिर I'm referring Mr. Newton for diagnosis and further assessment. You can also write into your care if you want, or you can just skip that. ठीक है, एक ये तरीका हो गया. और In view of the above, your further evaluation for possibility of either, that I have mentioned there. Again, I'm writing the main thing, which, it's not a good thing, but you can write. Agar aapka introduction, if you have written introduction in some another way, so you can use this either what? Crohn's disease or ulcerative colitis would be appreciated. Okay? Or you can write it as in view of the above, your further management would be highly appreciated. You can simply write that also. In view of the above, your further management would be appreciated, or you can appreciate it again, मैंने ऊपर लिख दिया है, would be highly valued. Okay, you can write it like this also, but my preference will be, if I will just write wait a minute. Or you can also write, okay, I'm just writing in view of the above, I'm referring this okay, Crohn's for 1 minute. You can also simply write like this also. I will write my my preferred introduction in the end. In view of the above, I would be grateful if you could assess and manage. Again, assess, diagnose and manage his condition accordingly, you will write, because again, I have to make the diagnosis also. Assess.
Here we can write that in view of above, it would be greatly appreciated if you take over the patient and like take over, because we are sending to the gastroenterologist now. He will be taking care of the patient. So can we write like that? Like, it would be greatly appreciated if you take over the patient and do further assessment and management.
एक second. Well, this kind of a conclusion you can write when you're referring the patient back to his GP.
Okay.
जो आप किसी जीपी को रेफर करते हो ना, तो आप उसकी केयर में कर देते हो कि फाइन ठीक है, आप उसकी केयर में कर रहे हो, यहाँ पे आप उसको क्योंकि आपके पास यहाँ पे आपका उसका यू आर गिवन अ टास्क, डायग्नोस करना है, ट्रीटमेंट करना है, ठीक है। एक सेकेंड मैं भूल जाऊंगी, जस्ट लेट मी राइट मिस्टर न्यूटन अकॉर्डिंगली।
आई थिंक हमें बहुत कंसाइज रहना चाहिए, शॉर्ट एंड कंसाइज।
कंसाइज, शॉर्ट। अब अगेन जो आपने कहा ना कि इनटू योर केयर, ये वो, दैट्स गुड, यू कैन राइट दैट आल्सो, बट आई वुड प्रेफर दैट राइट दैट काइंड ऑफ इंट्रोडक्शन व्हेन यू आर रेफरिंग द पेशेंट बैक टू तो जीपी बैक इनटू द केयर ऑफ ए जीपी, जैसे आप डिस्चार्ज लेटर लिखोगे या फिर आप किसी जीपी को अपडेट करोगे उसके ट्रीटमेंट के बाद, ठीक है, तो आप उसको कहोगे कि फाइन ठीक है, आई एम जस्ट सेंडिंग दिस पेशेंट बैक इनटू योर केयर, टेक फर्दर केयर या इनटू योर केयर फॉर फर्दर मैनेजमेंट, या फिर हैंडिंग ओवर या फिर द फॉलो अप केयर, that will be more relevant if you are writing to the GP. Okay.
Okay, I got it.
इस तरह करके
Because
you can write
usually,
now. The last introduction, sorry, मैं I will just forget it, that's why I'm just क्योंकि इतना मेरे दिमाग में आ नहीं रहा एक साथ, so just excuse me. Okay, then last I will just prefer is, okay, Mr. Newton, uh, you can also write here in view of the above. Okay, I will just write it in view of the above, because many people just write that in view of the above. Mr. Newton is referred to you for further evaluation and confirmation of his diagnosis. Okay, full stop. शुड ये ऊपर ही आएगा क्योंकि मेरा एकदम नीचे चला गया, एक लाइन का गैप नहीं आएगा ये, यू विल जस्ट राइट नेक्स्ट, देयर इज नो नीड टू राइट अ गैप, बट मेरा एंटर में चला गया. शुड देयर बी एनी queries, please do not hesitate to contact me, full stop. Then you will write it here. Your I'm not good with this, Alex. Yours sincerely, comma, doctor. And sometimes people also get confused that most of the time in this writing task they mention, okay, fine, you are a doctor, you're a GP, you are a working GP, yeah, the name, like you're a your doctor Hina, a working GP in this clinic, and now you are going to refer. So if that's the case written again, if you write the doctor over here, then there is no issue. But if in most of the time, in most of the case notes, I have seen that they just write the name of the doctor also who is writing the referral letter. So you can, instead of that, you can write it the name here which is mentioned in the writing task. Now, yes, what's the question? And yeah, this would be my preferred introduction, sorry, conclusion, which is different. उसके साथ पैराफ्रेज मैंने कर दिया इसको, और मैंने वो कर दिया. ये वाले भी सही है बिल्कुल. एंड दीज आर मोर लाइक अ स्क्रिप्टेड वन, हर कोई अपने लेटर में लिखते हैं. यू कैन मॉडिफाई और यू कैन जस्ट लर्न, and you can learn introduction and conclusion, a template. You can just make your own template. Because see, either the letter will be transfer, or it will be a referral letter, or it will be a discharge letter, or a urgent letter. So you can make a template according to your preferences. Okay, you can just make your own template, and you can fix in the condition in between the template in the introduction, also in the conclusion also. You can just make it your own template. Okay, fine, ठीक है, मैंने if I have written this in the introduction, then I will write this in the conclusion. Okay, fine, if I'm just not writing this in the conclusion introduction, then okay, I will then mention this in the in the in the introduction. For example, अगर मैं जैसे यहाँ पे अगर ये है, अगर कोई इन्वेस्टिगेशन भी लिखी होती है, क्योंकि फाइन ठीक है, MRI अल्ट्रासाउंड भी करवाना है, फॉर एग्जांपल प्लान में लिखा होता है कि एडवाइस ये सब कुछ करके, या फिर एडवाइस MRI अल्ट्रासाउंड, MRI एब्डोमेन है. सो इफ आई हैव जस्ट रिटन दिस, I can also write, okay, fine, ठीक है, your further assessment and investigation, your MRI would be highly appreciated, something. लेकिन if I'm not writing that investigation in the uh, introduction, then I can mention that over here also. Okay, fine, ठीक है, Crohn disease and further investigation such as this MRI abdomen would be highly appreciated. तो मैं वो एक चीज यहाँ पे मैं mention कर दूंगी. लेकिन again, what I say to everyone, to my students particularly, that is, whenever you're writing the introduction, because end may, by the time you will reach the end, the conclusion, you will be exhausted, your time will be running, so it's most likely that you will be writing the scripted introduction, sorry, the inscripted conclusion. But when you are writing the introduction, you have plenty of the time, so you can make your introduction better, you can make it clear, concise and precise. And if you will just see in my whole letter, I have not used any kind of complex sentences, or difficult wordings or difficult anything. I have written it very in a very simple language. बहुत सारे लोग गलतियां करते हैं. Okay, sorry, what I was saying this, that okay, fine, see, I have written the letter in such a simple words. Okay, I have seen many people just complicating everything, that they will just write has, had, have, had, and even they have no idea about when to and where to use these kind of tenses. If you can write that in simple English, you just write it in simple English, in simple sentences that is understandable and very easy to read, instead of just making the sentences very complex and difficult, to just get the outline, or it's not that clear to the person who are for the reader, that what exactly you are writing. So it's better to avoid that. So here is the letter for today. I will just says these are the different types, different ways in which you can just write the conclusion, and it just depends upon you. And to see, if you will just see the content, see the content is on the point. There is no irrelevant or unnecessary information has been shared that that's not required by a gastroenterologist. I'm writing to a doctor who is a doctor of abdomen or gastro, so I will just not mention anything irrelevant. I hope you like this. Thank you.